This is the time of year when people want to show off their skin.
It is part of what's triggered a growing trend of patients wanting laser hair removal. Last year, it was the third most popular non-surgical cosmetic procedure performed in the entire country. But the eye team found little is being done to ensure the people who perform these procedures are trained or supervised. And as Terry Grucker reports, some consumers are getting burned.
This is the ugly side of laser hair removal, a side that can be life-changing. The eye team found the people performing these procedures in Minnesota aren't being tracked or licensed and are minimally trained.
What type of training do you go
Not
through?
much.
Not much?
Well, they're really, I was down in Florida for a week and learned how to run a laser.
The eye team went undercover for a consultation.
It's pretty hard to really hurt somebody with a laser.
Tried telling that to this woman.
I did have good enough skin to where I would feel confident without makeup. Well, today I don't feel that way at all.
She had laser hair removal at the same clinic the eye team visited. 4 months later, she's still recovering from burns to her face and doesn't want to be shown.
The lady assured me that it would only take like 2 to 3 days and this should clear up. Basically, anybody can do this, and that's not right.
A doctor has to buy the laser necessary to remove hair, but the eye team found in Minnesota, anyone can operate it.
In the first year that I lasered people, I undertreated and overcharged everybody because the things that you see happening with the laser scared you.
States like Wisconsin require a physician to supervise laser hair removal and require hands-on training and continuing education. But the eye team found Minnesota requires none of that.
There are serious medical instruments that should be supervised by a physician.
Dr. Charles Crutchfield is a dermatologist and worries about the growing number of patients he sees suffering burns at clinics across the Twin Cities.
Burns, if they're superficial, they can leave a dark spot that might last several months. If they're deep, they can actually form a scar, and that's lifelong.
Even though it's not required, he supervises a laser hair technician who performs procedures in his office.
There is potential for complications with the laser. It is a medical device, and people need to be properly screened before treatment.
Medications like Accutane can trigger trouble. Lasers are not recommended for use on people with blonde hair, gray hair, dark skin, even tan skin.
Yet the clinic where this African-American victim went still performed the procedure on her.
They said that they had experience doing this with one African-American guy, and he had pretty good results. So they were saying, we might be able to help you.
The clinic says it no longer does laser hair removal on black skin, a change too little too late for this victim.
I always tell people, the bitterness of poor quality lasts much longer than the sweetness of low price.
We tried to figure out who's overseeing these clinics. The State Department of Health and the state boards of medicine and cosmetology all said, not us. But the FDA told me it's up to each state to come up with rules for laser hair removal. Clearly that's not been done yet here.
Well, what can a customer do then to make sure that the clinic is actually safe?
The best advice is to definitely talk to your doctor, see if you're a good candidate first, then get a referral. They should be able to tell you who's operating the laser under a licensed doctor's supervision. They say that's key.
All right. Thank you, Terry.